Well, the European Union says mandatory COVID-19 screening for travelers arriving from China is unnecessary. Surging case numbers in China have led the United States, Italy, and some other countries to test arrivals. Italy has called on Brussels to impose the tests across the EU too. China has scrapped some travel restrictions and is planning to ease more quarantine rules. And I'm very pleased to welcome Ian Lipkin, an infectious diseases expert at Columbia University, for more on this. Do you think, in your view, it makes sense to impose mandatory testing for people who are arriving from China?
I don't think it's going to make a large difference. In first place, it makes a difference what test you use. The antigen test, for example, may miss individuals who are infected. And if you can start travel during a period of time when the virus is incubating in your body, we may miss it with an antigen test. The PCR tests are much more reliable. So even thinking about the testing itself, I think there are some things that need to be revisited. But in addition, what we've learned over decades with these sorts of illnesses is that they're typically already within those countries that you were trying to protect themselves at the time they imposed these sanctions. So I imagine this variant is probably already circulating in Europe and in the United States.
Well, the U.S. Health Agency, the CDC, believes China's not being transparent enough in sharing data in order to actually have a real picture of how many cases there are and the potential for a variant of concern entering the United States. Now, you personally were allowed to travel to China in 2020 to investigate the origin of COVID. From what you've seen, how justified do you think U.S. concerns are?
I think transparency is an issue, and I think that transparency is a problem in China. We don't really understand the full extent of the outbreak there. We believe it's now nationwide, and it's going to have terrible consequences. I never favored, for example, the idea of shutdown and zero COVID because it wasn't realistic. It is useful early in the course of an outbreak and allowing you time to vaccinate people. But that really is our first line of defense.
Are the consequences then now inevitable? What do you think the best approach would be for governments?
I think China is going to have a tremendous loss of life. It's very sad. It's going to look very much like what we had in Europe, particularly in Italy and the United States, in New York, where I live, where it was an enormous burden of morbidity and mortality and long COVID as well. So it's very difficult right now to say whether or not they will be able to vaccinate enough people rapidly enough and to boost them so that they can get a protection in time. But I think that there's going to be substantial loss of life in China.
Well, thank you very much for taking the time to speak with us on DW News. That is Ian Lipkin, Professor of Epidemiology at Columbia University.